Welcome to COVID Convos. I'm Maddie Carver, and today I have with me Jennifer Kenson, NCIDQ, IIDA, ASID, Interior Design, Principal, Healthcare, Francis Cauffman. She has a unique perspective on where the industry is headed and what their specific needs will be in these unprecedented times. I'm thrilled to welcome Jennifer Kenson. Hello, Jennifer.
Hi, how are you?
I'm doing well. How are you?
I'm good. Thanks for inviting me to do this today.
Well, I'm so thrilled to have you. How are you doing working from home?
Handling it okay. Kids are fine. Computers are working great. FCA did a great job of kind of ramping us up, way before this to work offline and be remote and work between our offices. So it was pretty seamless for us. So we've been lucky in that way.
Good. I'm glad to hear that. And I do, we all miss working face-to-face and having that face-to-face collaboration, but we are lucky to live in the times that we do where we have this type of technology to keep us all in touch. So that's good stuff. So yeah. So Jennifer, I'm going to just jump right in here. Again, I am so happy to have you because, we've heard so much discussion, debate, conjecture on what the future of the workplace might be, and I'm very interested to talk to you what the future of healthcare might be. As I've said to a lot of the people that I've interviewed, I know that you don't have a crystal ball or a magic wand to kind of look into the future to know exactly how things might be, but you might be able to give us a little bit of a better perspective. What do you think, in a broad sense going forward, things might look like, and what are you kind of hearing from clients? What are some of their concerns?
I think there's so many unknowns. I think our clients are really reaching out to all of their consultants that they work with to get their feedback. I don't think that they know where they're going, mostly because the COVID research is ongoing. They don't know how long it's going to last. They don't want to overreact. If there's a vaccine that works and is valid within a year, they don't want to have the repercussions be long-lasting of their infrastructure and their spaces to impact long-term. So they're looking for their consultants from architects, designers, and all of their mechanical, electrical, plumbing engineers to kind of be a resource for them. For all of our clients, they're reaching out to everybody. So it's been a good lesson, a learning lesson to kind of have these conversations with everybody.
Sure. And obviously from, the standpoint of like an emergency room or a situation like that, healthcare is kind of on the front lines of what's happening right now. But, moving forward, what do you think about maybe urgent care facilities, clinics, private practices? There's been kind of a trend of the healthcare space as a spa feel to keep things warm, inviting. How do you think you can encourage kind of some of the new safety protocols and the sanitary protocols while also maintaining that sort of new trend of a spa atmosphere or a warm atmosphere?
I think there's going to be multiple approaches. I think the physical infrastructure is going to look different, perhaps. I think they're going to handle a lot of things from an operational perspective. So how long you spend in the physician's waiting room might be eliminated if they can operationally figure that out, to just reduce the amount of time that you're exposed to other people. So to keep that spa feeling and make a space feel warm and inviting, but also instilling confidence in patients that they are clean, they are cleanable. We're going to have to look at multiple ideas, and I think the availability of products is going to help us be able to do that. There's so many things that are customizable that we can begin to have that overlay of signage and messaging to do the separation and wash your hands and make that a visible nudge to do the things that we want people to do, but integrate that into the design of a space and make it feel not so add-on and not thought through, but make it feel cohesive still as a spa.
Sure. How can, this is an interesting question that maybe you have an opinion on. You just said that products are going to be important. How have you at Francis Cauffman been dealing with reps, with manufacturers? Because it is such a tactile industry, and you need to see things in a certain light, feel things. But obviously, we can't do that right now. How have you and your designers kind of been dealing with that?
So we have looked at it on a per team project basis, and so one designer on the team will be the source for ordering all of the samples, and we've done Zoom meetings or using Microsoft Teams to kind of take pictures, show the palettes on somebody's bedroom floor, kitchen floor, and just do it virtually. If there's something that we each feel that we need to see an actual sample of, we'll maybe two people will look at it so we can have a multiple opinion approach. The reps have been great. They have been really communicative and responsive, and eager to help, because I think they miss seeing us and we miss seeing them. So it's been a good working relationship with everybody that we've had to deal with. Where we struggle a little bit is the shop submittal process, and having contractors having to send samples to our house that are record to document that we have to sign and seal and get back. We've figured out a way to do that digitally as well. So far, so good.
Right. Necessity is a great breeder of coming up with solutions. So, we've also heard quite a bit about there's kind of a push to work outside. There's a push to kind of bring nature in. And also with what's happening with COVID, they're saying that as much as people can be outside, that's kind of the way to go. How do you think maybe healthcare can answer that push? And what do you think is maybe a trend that you might see in that space with being outside and nature?
So biophilic design is really important for the healthcare setting, and we definitely are applying those principles to our projects. I think it's more difficult to be physically outside in healthcare settings because of all the guidelines, mostly from the protocols of the healthcare providers. Once you're, for instance, in an emergency department, once you're in the facility, you're the responsibility of that facility. So they have to be able to have eyes on you at all times. So it's difficult to allow people to wander. So to go out to a healing garden and the nurse isn't there, you can't really do that. So that's a little bit tricky to handle. It has impact on staffing, amounts of people staffing. I think operable windows is possibly something that we'll have to get thought about, maybe in an ambulatory setting, maybe low rise. I think it's trickier to do in city, urban settings, just because of the safety issues that we have with high-rise buildings, and having the windows only open more than 3 or 4 inches. What will the impact be of that? So it's not an easy answer. I think again it'll be different solutions for different locations. I think the cost of ambulatory settings, there's a lot of return air plenums. The walls don't go up to the ceiling, but then you're sharing the air with every single room. That might have an impact in introducing fresh air into that mix more frequently with open windows. Might be something to study. Doesn't always work all over the country. Maybe somewhere more temperate, equal across the year is better suited to that than somewhere that relies on air conditioning a lot of the summertime. Like it's not an easy thing to do.
Sure. That's an interesting question. Also, maybe the implementation of some of the garden walls and things, and maybe waiting rooms and things like that, and trying to make people feel a feeling of freshness. And I know that the HVAC situation is also something that a lot of businesses are looking at, and I'm sure people in the healthcare industry are looking at the fresh air aspect. But again, when you're in Philadelphia in sub-zero weather, or in the city, that's not always an easy thing to think of.
This might be more air exchanges required baseline versus what is on the books now in the codes. In healthcare facilities, it's pretty prescriptive. Maybe that'll have to change to be more air exchanges per hour, fresh air intakes. It'll have impact and cost for the infrastructure for sure.
Now, this is a question that's a little bit off the beaten path here, but so many of our healthcare workers, like I said before, have been on the front lines, and a lot of our healthcare systems, they felt that they weren't prepared. Going forward, how do you think the design community can, maybe innovate in ways that makes us more prepared for the next pandemic, or makes us more prepared for the next healthcare, public health crisis? Is there an answer to that?
I think that the word of the day is flexibility, and building in flexibility into their buildings, and acuity adaptable. In a critical care hospital, acuity adaptable rooms have been instituted, and it gives a lot of flexibility. There's a lot of drawbacks to those situations too, because you have to have the staff trained up to treat patients at an ICU level. So it's not an easy fix, but it gives you, if all of your rooms are equipped with all the medical gases and electrical requirements and air exchanges of an ICU room, but you don't use them that way for most of the time, it does build you that flexibility in the future. So that's kind of one thing to look at, and it's gone one way and it's gone the other based on the infrastructure costs kind of outweigh. So I think there'll be kind of fresh eyes looking at those kind of things for the future. And I think the impact of providing safety for the staff, I don't think we know exactly what that means yet. I know we're doing some projects right now that are in design, and they want more protection for their staff, but they don't want to give up the visibility to patients. So they, is everything now going to be enclosed with glass? I don't know that that's the right solution. Does it give the protection that they need? If there's no doors behind the nurse station, but they have glass in front of the nurse station, is that going to do enough? I'm not sure. But we're talking to ICU nurses that have been in the thick of things. We have friends out in the industry of our coworkers that have worked in area hospitals, so we're getting great feedback on what they're dealing with, and hopefully we can, talk to them in the next couple months when they're a little less overwhelmed, and really get great feedback from them.
Sure. Well, that's interesting to hear, and it'll be interesting and hopefully heartening going forward to find out what's going to be happening. So Jennifer, we're talking about a lot of very, serious and interesting topics, but we've now come to the time in my COVID Convos where I ask you if you can suggest any music for my quarantine playlist, or what shows you've been binging that you can suggest to my little audience I have going here on LinkedIn.
All right, I got a list here. So,
okay, awesome.
So beginning of our pandemic time at home, I watched a show called The Restaurant. It's a Swedish period drama about a restaurant during Prohibition. I just loved it. There's 3 seasons, but I've only watched the first one.
Netflix? I'm sorry to interrupt, but Netflix, do you remember what platform?
I think it's on Prime, and I think it might be part of BritBox. I can't remember.
Okay. All right. Well, I'm going to look that one up.
It's definitely on Prime. It's called The Restaurant. If you don't mind subtitles. You got to be in the mood for subtitles.
You do, but my husband and I just watched Parasite the other night, and it was all subtitles, but we loved it, and we just zoomed right through it. It was great.
Yeah. And then, so I have a teenage son and a 12-year-old daughter, and so I like to keep tabs on what they're watching or they might watch.
Uh-huh.
So I watched I think it's called All American, about a high school football player and his life, which was interesting. I don't think my kids have watched that yet, but just in case they do.
Sounds like a good one.
And then I've been watching Outer Banks because my son has been watching that, so I'm glad he's watching.
That's really funny. What a good mom that you're watching that show. That's I love it. I love it, Jennifer.
It's not terrible, but it is kind of teenagery.
That's good. You got to stay abreast of what's happening out there with these kiddos.
Yeah.
All right.
And then I got my music list is kind of a little wacky, but and for no particular reason, I like electronic dance music. My older brother is the rave DJs to this day. He's 50-some. So I love a song called Water Baby by Tom Misch, M-I-S-C-H. And I love the song by Stormzy. It's called Own It, and it's a collaboration with Ed Sheeran.
Water Baby and Own It.
Yes.
And it's a collaboration with Ed Sheeran.
Yes.
Now that's different.
Stormzy an intense kind of English rapper, and Ed Sheeran's Ed Sheeran. So it's an interesting collaboration.
Well, I absolutely cannot wait to put together my whole Spotify list when kind of we're out of this and we can kind of listen to all these fantastic songs and all these, suggestions that I've gotten. And all of them are so different and come from so many different genres. I just love it. So thank you, Jennifer, for those suggestions. Thank you for all of your invaluable information and all of your insights. And I wish you all the best and good luck with your kiddos, and hopefully we'll see you on the other side of this someday in person.
Yeah, hopefully.
Hopefully. Well, take care. Thanks again, and we'll talk soon.
Okay, thank you.
Bye-bye.
Bye.